ahead and get started. I know people will be coming into the room here momentarily, but just a couple of logistics for today. So we are recording today's session. We will provide a link to the recording after the session is over, in addition to any of the materials that we cover for today. We are using the Q&A feature. We are not using the chat. So if you have a question or a comment, please use the question and answer. We've decided to do that just for the size of the audience and managing the time today. So again, welcome everybody, and I'll turn it over to Patrick to get us started.
Thank you, Craig. Good morning, everyone. What is being proposed through performance-based contracting is a transformational change. Change is always difficult. It requires work, commitment, thoughtfulness, creativity, and collaboration. Think about the changes during the pandemic. In recent years, our system has experienced extraordinary challenges, which have compounded our problems with our workforce, the quality of care we are able to provide, and in many cases, the ability to deliver services at all. Individuals, families, and providers are experiencing hardships like never before. The sustainability of our system as it stands currently is questionable at best. As difficult as it will be, our message today is to embrace change and to begin the difficult journey to make this system change work for you and the people you serve. You should examine everything carefully and critically and use the comment process to strategically provide your input on how to improve the current proposal. But at the end of the day, if we as a community are to succeed, we need to channel every ounce of energy and work together to succeed together. See everything, but see opportunity first and foremost. So let's begin this conversation. You're not going to do this alone, and our goal is to help you and the system succeed with whatever it takes to accomplish that. You can do this. That process begins with information and what to know. So let's bring in our special guest, Office of Developmental Programs Deputy Secretary Kristin Ahrens. Kristin, welcome. Thanks for joining us today.
Thanks for having me, Patrick, and appreciate your opening words. So I do want to just quickly alert everyone while they're loading the slide deck that we did get approval from CMS on the one-time supplemental payments to support workforce. We republished the link to go ahead to the next one, is about the supplemental. So you've got the announcement number. This was published yesterday. We got the approval as we submitted it. The major changes from the public comment period to what was approved, we did add 3% of revenue for needs exceptions will be included in the calculation for the supplemental payment. We had also, appreciate the folks who caught this, we had missed supplemental habilitation as one of the covered services to calculate revenue. So all of that was in there. These are by request only. We will only be sending these if you submit the survey and only if you submit it by May 15th. I can tell you right now, we are nowhere near even half of providers having submitted requests for these funds. So I really encourage providers to take this opportunity. If you need additional funding for workforce, it's hard for me to imagine that you don't. So, please make sure to submit those requests, and we will not, if it's received after May 15th, we will not be able to process that. So take a look at the announcements, got all the information you need, and I'm really happy that CMS was able to work with us to get this done in much less than 90 days for their review. All right, let's get into performance-based contracting here. Kind of what you need to know and do to prepare. So very broadly, Patrick will touch a little bit on this as well. I think my advice to the provider community at this point is really study the implementation plan and the performance standards that are out there. And a couple of things to take a look at very specifically is to really review what are the timeframes that either the new requirements go into place. So in yesterday's public comment session, we had a lot of questions on the DSP credentialing and kind of how that worked and when it began and when the expectations went into place. And so make sure you're really going through and kind of laying out for your own agency each of those. For primary reporters, there's a lot of these sections that are reporting, and obviously that means you have to come up with a way to do that, reporting. Some of it is reporting what your current policy is. Some of it is, reporting that you're going to have some kind of tracking system, but to really kind of start plotting that out and thinking about it in the timeframes that we've got outlined there. We did, with the support of the work group and then working through this, have tried to have it, essentially phasing in based on these new requirements. Take a look, and really get a handle for what are actually new requirements versus current requirements. And obviously some of those current requirements, we now have performance standards attached to them, but to kind of sort all of that out. And then again, what is simply a reporting activity from now, at a minimum from now until the end of that first contract period, which is June 30th of 26. Sort out what's just reporting, what am I going to be tracking and reporting and watching versus where do I have new activities that I have to be engaged in. And then can't emphasize this enough, Patrick opened with it too, and please comment. This is big systems change. If we do this and do this right, it's going to help with our workforce issues. It's going to help with our quality issues. It's going to help aligning payment with outcomes. It's going to help build clinical capacity. But as a community, we do have to get it right. And we do really value the comments in doing that. We know it is a big, complicated set of performance standards. We need input. We need input about how we have lined up sort of the operational stuff with the policy, with the fiscal tools involved. So I would really encourage comment and as detailed as you can make it to help us get these details right in terms of implementation. So that's the kind of first piece, is really setting aside the time to work through that as an agency. The second piece is to start, many of you are already in this space, but to really approach this with that mindset of continuous quality improvement, and then to take a look at what are my agency's structures to support a continuous quality improvement? Who do I have in place? How are they working across the agency? How does that get down, into the training division? To really think in terms of your organizational structure, how well are you organized to support something where we put out the standards for this first contract period, and over time, those will change, never more than once a year and never radically within a 3-year period. And I don't think we'll probably do super significant change even at those 3-year cycles. The point of this is to slowly build the foundation and quality in our system. But more dramatic changes would only be made on those 3-year periods. And then very importantly is to really evaluate how are you currently using data? What are your habits around that? Are you accessing the tools as an agency? Are you accessing the tools that ODP has made available? The dashboards within incident management, all of the reporting and queries that are within the inelectability within the health risk screening tool. Are you accessing all of those kind of things that are at your fingertips as an agency? What are your habits around doing that? How are you using what you see in there and then connecting it back to practice? All right, next slide. So that's, kind of the overall. And then, I mentioned one of the things I think it's important to do as an agency is to kind of sort out where are those more significant changes that I'm going to have to make, when is the expectation that those are occurring. remembering many of the things in the standards are current expectations and current practices. So we currently require incident management. We currently require health risk screening. And obviously for clinically enhanced and select, we've now set a number of performance target that has to be hit for that. But in many of these cases, the existing requirements, there isn't a change for primary providers. So again, kind of sorting out, making sure you've got a pretty good handle on all of that. And being a primary provider is a good thing. Like we expect a lot of providers are going to fall into that. We'll have performance, pay for performance that is designed specifically in some cases only available for primary providers, because we've already cooked some of that value-based payment into the clinically enhanced and select. Other, kind of, again, sorting out what's coming when is, many of the new performance areas we're relying on attestation and reporting during this first time period. And again, that's not nothing. I understand that is impact, that means work. I think that one of the clear examples of that is DSP credentialing. To be select or clinically enhanced, if you're attesting that you're going to get a 5% increase in the number of staff that are credentialed, that is obviously work. It is obviously money that you will be spending in order to do that. So I'm in no way suggesting that just because it's reporting or attestation doesn't mean there are activities and work that don't accompany that. But again, being clear kind of what those standards are. And then, also making sure in terms of the time frames, I've said, we'll keep building this over time. There are a number of areas where we that's reporting requirements that we are hopeful, as we're collecting the calendar year 25 data, that will help us with establishing some performance standards in 26, 27, 27, 28. Some of those I think are probably going to elude us for many years, but some of them I think after a year's worth of data will probably be able to be setting some standards related to that. All right, next one. So preparedness, aside from kind of, the mindset and some of the analysis, making sure you comment. The other things that you're probably aware that we have going on is we will be publishing, and this should be in the pretty near term here, provider preparedness tools. And we have some summits that are scheduled. The announcement went out yesterday, I believe, and I've got the dates in here. If it didn't go out yesterday, it'll go out today, for provider summits, where we will be going through the assessment, the toolkit itself, which is an assessment, a work plan, sort of guided work plan for providers based on their self-assessment, and then actually going through the measures themselves in more detail. So those sessions will be occurring. The toolkit is pretty comprehensive. It's also got some resources that are associated with that. The Residential Strategic Thinking Group was kind enough to continue doing work and did review that, provided some really nice feedback on it that we're just finishing up incorporating. So again, we should get that out to you pretty soon. And then, lastly, one of the things that will be ongoing support for providers is we have planned out quarterly forums that will begin in September, where we will be going through, some of the performance data that we're seeing at a system level, that we're seeing at a provider level, how providers kind of are distributed across the performance related to that, and working through all of those different performance measures. So I think those will be some nice forums to keep having the discussion about the new performance standards and, things people are struggling with or trying, whether it's understanding what's happening or struggling with in terms of performance. I think the ongoing dialogue with all of you about the performance standards and how this is playing out is going to be really important. So this is a formal, set of forums that we will be doing to support the changes that we're making as a system. All right, next one. This is just an example from the self-assessment that's in the toolkit. So go through the measure. I know there's some questions yesterday in the public forum. There will be things in the toolkit, like someone said, well, what counts as clinical staff in the 1 to 10 for clinically enhanced? That entire list of professional types will be in the self-assessment. When we're talking about hospital follow-up, what exactly, who are the types of practitioners that count as follow-up from a post-hospitalization? That level of detail will be in that toolkit to help you do those calculations and kind of think through where you stand. So it'll have the measure, it'll have the assessment questions, it'll give you an opportunity to note your preparedness level, and then it also distinguishes between, you can see what the difference is between, for the primary provider expectations, select and clinically enhanced. And where you've got the blocks blacked out, it means that is not an expectation for primary. So I think it's pretty intuitive tool. We're not collecting these are self-assessments just for providers only, for your eyes only. We will not be expecting to see them or collect them in any way, shape, or form. All right, next. And here we've got the summit dates. So this will, there's kind of 2 pieces here. So we are, so that everybody coming in has we're a little bit level set in terms of the understanding and can jump into more of the detail for these preparedness summits. We will have a recorded webinar that we're going to ask everybody to view before the sessions that we have. And then these sessions will work through each of the measures, and these are not repeats. So we would recommend that you're attending all 4. We're also recommending to make sure that we have the ability to get to all providers, that providers are only sending 2 representatives. These will be recorded, so they'll be available after as well. But we do want to make sure that everybody has access to it. So in this, again, this is for distinct, we'll be working through the different sections in the performance standards. So we recommend you come to all 4. We're going to go through the reporting, what the data sources are, the data collection, and the analysis for each of those standards in these sessions. All right, next, I think that might be it, right? Yeah, so I wanted to make sure we had some time for questions, and I know you've got some poll questions, right?
Yeah, maybe we can go to that. We thought it would be good to poll members, and maybe that's where we can start as we kind of go through a few questions and get some feedback. So maybe while that's happening, Kristin, a good opportunity to kind of start, go back to where you began, which was really with the money being pushed out. So, thanks, good news. So again, we will make sure we get out to full membership, the deadline, procedures. We do, of course, want everybody to apply for that. And I think it's also a good example of feedback, that we're emphasizing today. So, thanks to TPA members across the state. Other associations did speak up about the NEA, and you did make a change, correct, Kristin, on the NEA? So that was included where originally in the announcement it was not. Yeah. Was there anything else that changed with respect to that particular announcement and the request for public comment?
We had missed supplemental habilitation in the list of services that could be included, and I think we added program specialists as well. I think we had initially just said DSPs, frontline supervisors, and I believe we added program specialists after public comment as well, just to give that a little broader.
Okay, so Craig, I'll lean on you here for any feedback we want to get to. I've got a few questions that I think.
There is a very good question here that we also received before this session, which is, can ODP send out some kind of confirmation that the survey was received? We do plan on sending out, well, we've done this before, we just send out here, we did receive from these MPIs. So I believe we'll probably do something like that. So keep your eyes open for likely an email or announcement communication. We're not going to do individual responses at this point. I think we'll probably just send out a publication with the list of MPIs.
Okay, sounds good. Okay, how's the activity on the poll, Craig? You can see we got, a lot of responses. We're seeing a breakdown between everything. I think have not decided is not a bad answer right now. Information is really just coming out. So I think it's good to assess, and it's kind of part of the theme of today is to prepare. How to succeed involves some preparation. So, Craig, if we can sort of get to this and publish, Kristin, I don't know if it's available for you to see, if you want to kind of give a reaction. I think things are kind of evenly distributed. Right now I'm seeing primary 22%, select 29%, clinically enhanced 32%, have not decided 18%. So the question specifically for residential providers, based upon what you know right now, which performance-based contracting tier do you expect to pursue? And then we're also asking everyone to sort of identify, and I think this is relevant mostly for those of you that have taken kind of a deep dive and you're really familiar with all the performance standards. We're giving you the performance areas, and some of those specific standards are really where you kind of identify exactly where the lift is going to be and how difficult that is. So I think understandably, we're seeing a lot with workforce, and that does get to credentialing that you've already mentioned, Kristin. So, we have a breakout there. And, as I would expect, the things that the provider world is kind of used to doing, regulatory compliance, we don't have a lot there. I wouldn't have expected to see a lot of people having issue with some of the things that are just kind of in the wheelhouse of what we've done. But some of the changes, continuum is a change. A lot of high bars with respect to supporting individuals with complex needs. So, we have ratio issues. We have a lot of clinical team building, and we'll try to talk about that a little bit more in the latter part of this session too. But I guess we'll stop there, Kristin. I'll give you a chance to sort of respond to anything that you want or any other questions that you see you want to answer.
Yeah, I'm this doesn't surprise me a whole lot, and the risk management one, just if folks saw the data that we shared out with Isaac related to risk management, I mean, one of the things, 95% of providers are meeting that standard of less than 1% unreported abuse and neglect. The more of the struggle area, I think, is the timely finalization. Those measures are definitely more of a hurdle, but I think, again, the distribution of providers on that one is pretty good. Yeah, the rest of these don't surprise me as much. I guess I would have a question if anybody's willing to either pop in the talk to it or put in the chat related to Continuum. Is it a concern about standing up a new service, or the kind of the concern about the challenges of providing life sharing or supported living? I would just be curious what the kind of major concern there is.
Yeah, Continuum coming in on the poll at 12%, as far as, I'll just say it as the biggest lift in terms of implementation.
Yeah, and the workforce one, again, does not surprise me. This, please comment. I mean, we tried to put what the increase by by 5% was something that we used our current, we put out the ARPA funds now almost a year and a half, 2 years ago, to support credentialing. So we have numbers from how that has been progressing in terms of how many staff are credentialed in PA to date. So we used existing data, used the survey data that you supplied to kind of come up with something that we thought was reasonable in terms of, what do we reasonably think we can get credentialed between, July 1st and 12/31/25 by the end of this next calendar year. But this is, we would definitely like to hear about this. This is obviously an area that we're looking at investing in through pay for performance. We understand this is something that costs money and you've got to really organize around. So would very much welcome comments about kind of where we establish those standards, any other barriers or anything you think would be helpful in supporting that. But agree, I think the credentialing necessary, like we've got to get there, but definitely not an easy lift.
Yeah. And Crystal, I want to be mindful of your time. So I know you have a hard stop here at the bottom of the hour. Encourage everybody to continue the questions. We'll share those. I promise we'll get those to you too, Kristin, for the sense, of you being able to see some of the feedback. I wanted to make sure we revisited some of the high level things as well. So I'll just kind of quickly go through some of the takeaways that I've heard, that I know I've talked to members about. So all res providers are included and will be offered residential provider contracts. So I think that's an important distinction I want to make sure everybody's aware of. The tiers will be assigned on a provider basis, so not by service location, not by groups of people in particular.
Yeah, correct.
So very clear that this is a provider tier assignment. It is not a segment of your operations. Tiers will remain in effect until the next review period. You've already covered this in your presentation, but something I just want to emphasize. I know there's, for provisional revocations, there's some rules that affect that, but those are the only circumstances where there'll be a change outside of period. Providers must meet all performance standards for a given tier. So it's not a grade out of 50, 60, 70%. I know you've talked about attestations being acceptable in the first cycle. Any provider who meets all standards for a given tier will be awarded that tier. In other words, no rationing, no grading on the curve. If you meet the standard, you meet the standard. And we've talked about attestations. And timeline, just to be clear, contracts expected in June, data collection by providers in July. And you've mentioned that the preparedness form is not something you're going to collect, but can we assume that's going to align? Your data collection is going to align pretty closely with what you're asking for providers to look at internally on the preparedness document? Okay.
It aligns exactly. The preparedness document goes through everything.
Okay, perfect. And from August to October, ODP will analyze all the submissions from providers. So everyone who signed a contract submits their data for a tier assignment. And then sometime beginning in November, assignments will be made to all providers for the effective date of January 1st, 2005. So I guess in follow-up to all of that, does ODP sort of have a sense of provider readiness right now? I know you haven't worked on the toolkit, everything's not complete, but I think while I saw a question in the Q&A, you made note of this yesterday in the presentation, the ODP stakeholder feedback sessions, that you're going to use 2023 calendar year data, I believe, for employment.
There's a few areas. The incident fidelity. So the incident, the unreported incidents, the timely finalization, the health risk screening data, employment, and I think that's it.
Okay.
Yeah.
So there will be, there are some things, attestations clearly will not be what you're looking for. You would be actually looking at that data to see if people met standards in those areas.
Right. And the clinically enhanced one, the other, some of the existing data we're not going to be requesting. There are a number of these data sets ODP has. So when we are looking at the, that measure for the acuity of the residents served under that MPI, we will be pulling that. We're not going to ask for providers to report that because we already have it. So there are a number of those data elements that we will have.
And one of the key open areas remains pay for performance. Mm-hmm. So are you able to speak to that a little bit, especially with anything maybe upfront that would help investment in infrastructure?
Yeah, so the one that I would like to get out to all of you sooner rather than later here is the first one out the gate will be related to credentialing, and we would like to get that out even before the January 1. We'd like to get that out this fall to support the efforts toward credentialing. I know it takes a while for DSPs to get through the process, and I know that obviously there's funding for the training itself, and then if there's incentives or pay associated with that, some real cost to providers. So that is our top priority, is to get that all structured out so that you know what will be available.
Okay, and does that mean you would commit to providers who would request that? What sort of performance would you be looking at? There again, would it be we set a goal to achieve something and you would possibly get funding?
Yeah, I don't want to get ahead of myself on it, but no, this one we'd like to get to be able to build the capacity. So probably not any kind of target or baseline on that one.
Okay. Okay. We're at the bottom of the hour. You got to run? Okay.
I'm sorry.
Yeah, thank you for the time. We'll encourage everybody to keep the questions coming in. We'll follow up with you, Kristin. Thank you so much.
Yeah, and please, I love I can see from the chat, there were some responses on the continuum question that I asked. So if you can make those available, that would be really helpful. Yeah. Appreciate you holding the session.
Yeah, we appreciate you accepting, as we appreciate our members for putting those in and providing you the feedback. So I'll promise you both we'll connect the dots there.
Great. All right. Thank you so much. Have a great weekend, everyone.
All right. You as well. Okay. Thanks, everyone, for all of your input. As I just said, we'll make sure we get everything to Kristin to the extent she's able to respond. We'll get that out. Craig, maybe we can do that as part of the wrap up to this meeting. If we're able to turn that around, and if not, we'll certainly, when we get the recording and everything out, we will make sure we follow up with everybody. So I do want to emphasize the funding, the 6%, 3%, very tight turnaround on that. So again, we will emphasize that and continue to do so. Make sure you apply. And it was one of the things that we had actually asked for consideration to just push that money out, because this is often the case. People miss the application deadlines and, money is left on the table. So make sure that doesn't happen to you. And I think we'll take a moment here to just kind of reflect on some things. I want to bring in and introduce Scott Bachik and Scott Labatch, who are our guests today. Gentlemen, welcome. Thank you very much for being here with us.
Thank you, Patrick. Pleasure to be here.
Yeah, so I think, we just kind of left that slide. Can I just backtrack for a second? I just want to kind of revisit sort of why I wanted to make a distinction here. And I think at this stage, there'll be like a pivot point when we kind of go into, Kristin can lay out all the policy information, but organizationally, there's a lot that you have to do as an organization, that we all have to do as an industry to really make this succeed. So I think it's critically important that you really know the information. And by saying stated goals and objectives, I think it's not just reading the list of, what is going to be 91 different performance areas that you're going to ask to look at and self-assess on. It's really just understanding the concept, the methodology, the intent. And I think that's why when we refer to this as transformational change, I think to do all of that and have the same sort of operational structure and policies and everything in effect organizationally, I think that's not where we want to be as an industry. I think this is a very high bar, and we have to approach this first and foremost with the information. And I think Kristin, and I appreciate her taking the time to do this, laid out a few things, went into a little more detail, and I think she is also informed by some of the discussions that she's been able to have with stakeholders. They've opened up these feedback sessions. I listened in for the session yesterday, so got a good sense of some of the questions, concerns, and issues that providers across the state have been raising. So I know many of those are not unique, but I think we've gone through most of this. I really just wanted to emphasize understanding the plan. Kristin will say and has said, read the document, read the implementation plan. I think as another sort of indication, encouraging you to put your individual comments together, be strategic. ODP has made a lot of changes with the input of the strategic thinking group and from provider input on comments. If you look at the two documents, concept paper and implementation plan, there clearly are changes in movement. And you heard Kristin say today, they want that input because they want this to succeed and they want to know where it needs to be improved and can be improved. They can't do everything we ask for. There's clear evidence of that, but we still need to provide that input. So, we are going to talk through some of these things today. And, I think it's important also when you consider what to know, you have to know things about your own organization, take a deep dive into what your own capabilities are, so you can do the goal setting in an appropriate way that we can all meet targets. So you can flip to the next slide, Craig, and I guess that's what this is. I think we'll take a moment here. I'll let you guys sort of weigh in with any thoughts on what we've just heard and talked about, and Craig as well, if we have input here that you think we should address from the audience today. Let's take a moment and do that. Scott or Rob, anything from you guys?
Go ahead, Scott.
Yeah, I have a number of things, but I think, Patrick, as I go through some of my slides, I'll kind of mention it within there, kind of integrate it into the points I'm making there.
Okay, well, why don't we, I want to go our deck one last second, Craig, just so we will, to kind of frame where we're going to go next, guys. And probably what I'll do here before we actually go really into your deck specifically, I want to talk a little bit about, the how to succeed. So, I think what's up there on the slide, Craig, and if you can't go back to it, it's not a huge problem. I think we're just looking at everyone and sort of encouraging you to develop a plan. And, the plan elements are really around infrastructure, partnerships, data, culture, and strategy. I think that Kristin can set the standards, she can articulate her vision, she can inform us of what to do, but she really can't tell us how to do it. They're going to ask us to complete a checklist for our own benefit. It's largely going to mirror what they're going to ask you to provide. But we have to figure out how to meet the performance standards. And I think that's what we really want to go to next with you, with our guests here today, to talk a little bit about how we do that. Kristin can make it clearer to us, but making it clearer doesn't necessarily make it easier. So, we have to really think transformationally as organizations and as a system, not just that this is ODP imposing something transformational on us and on our community. So I think we have to somehow keep this simple, keep this very direct, stay focused on goals. So I think as we kind of go into sort of what we'll refer to as best practices for success, I kind of wanted you guys, Scott and Rob, to really just kind of remind us of your past experiences, things that you've gone through in similar transformations in other industries and other parts of healthcare. Just you can briefly both do that. And then, Scott, we'll go to you first to talk about becoming a data-driven provider.
Yeah, sure. Go ahead, Rob. You can give your background and then I'll.
So just for folks that don't know me, I mean, my background is with managed care provider networking before I became the president CEO of Hope Enterprises. So provider readiness, getting providers ready for transformational change, as Patrick had mentioned, and what we're going through right now, is really one of the things that I've focused on in years. And one of the things, and we can get into this as we go forward, is internally, what are your organizations doing? How are they pivoting? Is there work groups? Are there different things? How are interdepartmentally are we looking at those types of processes? And so we can dive in a little bit, I think, with in this presentation. But I mean, really, do you have a structure in place organizationally to go through the plans and go through, create action items and those types of things? Many of you probably do. You might have a form, you might have a formation of it, or you might be very advanced with that. But I think many of us, and I could speak for Hope in general, is, we have an internal work group that's moving along. We're bobbing and weaving as this is happening. Timelines are occurring, those types of things. And so, but what I wanted to just in opening is really stress is that infrastructurally means your organization. Do you have the right people around the table internally? And are we communicating? There's a lot of information there. Are we communicating that across your organizations? So that's kind of, but Scott, you could probably go into that. I didn't want to steal your thunder with data and what we do with those types of things, but I'll let you kind of go, because I'm sure through the conversation we'll get into that.
Sure, appreciate that, Rob. My background, just Patrick, to your question, I've been in healthcare over 30 years, and a large part of that is on the physical health side. So starting in the 90s, actually worked in the western part of Pennsylvania at the AHN Health Network, which was at that point was called AHRV, and Mercy Hospital. In those hospitals and the systems, we were part of the decision support team. So as physical health went through the same transformation of going from a cost-based to fee-for-service to performance-based. Physical health's been doing this for 20 years. I was part of the teams that build the infrastructure and decision support systems to help hospitals, because as this occurs, the number one thing that you have to have your infrastructure digitized. And I'm going to go through this in my presentation, but part of that digitizing of it, it creates efficiency, access, insights. So I've been doing this for probably 30 years through physical health side, and now in the past 6 years here in the human services side.
Well, thanks, Scott. We'll go to your presentation slides and we'll bring those up and we'll let you walk us through that.
Okay, I'll just share my screen.
I think Craig has it teed up.
Oh, okay.
Craig, are you able to load it?
Yep. So I'm part of an organization called the BI Collaborative. We do business intelligence and data analytics for human services only. We're based here in Pittsburgh. So that's a little bit of our background, and you have my background. So you can go to the next slide, Craig. Patrick hit upon this as you understand what's occurring here in Pennsylvania, it is definitely change is in the wind, right? And again, to my comments, we live this on the physical health side in hospitals and health systems across the country. This is now hitting human services. As you work in an industry of change and the dynamics that's occurring, it's important that you hit these key elements and understandings. And I'm not going to go through all these, but there are a couple key ones that I want to mention. That first one, the continuous environmental scanning, even though this is happening here in Pennsylvania, it's also happening in other states across the country. This is a trend that's jumping out in the forefront now. It is not going away. It is going to continue to evolve and get more sophisticated. Where we are today is not where we're going to be in 3 years from now. And it's going to be happening in other places, other states around the country. I was at a conference in DC where they had all the Kristin Ahrens of the country there. That was one of the #1 topics. And everybody's interested in how other states are doing it. And so they're going to learn from each other. So it's important that you understand that. It's important that as you go through this to stay customer centric. And again, I'm not going to go through all these. Patrick hit some of these in the beginning, but I think as you look at these, kind of the common themes of it are, you have to be able to adapt and be agile. It's just like animals in the wild that have gone extinct. Their inability to adapt has caused issues. Same thing with this. This change is coming. You have to be able to be agile and be able to change to match this as you move along. And this last point there on the right, to become a data-driven organization, as I mentioned, it's one of the keys of having that. So if you could go to the next slide, please. So why is it important to be data-driven? These are the benefits from it. So a lot of decision-making today is intuitive, and some is decision or fact-based, but you want the organization to be doing fact-based decision. This will help improve financial performance. It helps you improve your quality and risk management. It enhances staff engagement. So you think about today in your organization, and this is one of the #1 things that people struggle with, is so much data is being managed manually in Excel, and I'm going to talk about this in silos across the organization. If you're able to automate that and take that part of people's workload away through that automation, it becomes a great staff engagement piece. It gives you enhancement of customer insights as well as organizational insights, because you're taking information from disparate systems and combining it, and I'll show you that in a minute as well. And then it increases efficiency, which I mentioned. And those last two, as we go into this pay for performance, make no mistake, it's starting here, but our market, which has not been competitive in nature, will become competitive in nature. And so your ability to be agile and innovate and adapt becomes very, very important. So next slide, please. So some of the key points from some of the think tanks across the country, McKinsey, Aberdeen, Forrester: data-driven organizations are 30% more likely to reach their goals, 6% more profitable, and 173% more likely to comply to regulations. So big research done on being data-driven. obviously in today's world of AI and informatics and all the evolving technologies, data is the new gold, and it is important. So, and this just shows some of the results of that. Next slide. So if we look at the world today for you guys as providers, this is a typical scenario, right? So you have disparate systems that sit everywhere. They're not connected, they're siloed, and this creates a lot of complexity. And you'll notice in the middle there, that big manual Excel file. So a lot of data, and every provider that we work with is done in Excel. And so because of this, it creates inefficiencies. It creates a lot of work. And if you think about this performance contracting, I think there are 83 elements that are needed to be discussed, and not all of them reported. But you think about all those components, and it's not just reporting of it; it's managing it and understanding your improvement within those elements across time becomes critical. In this infrastructure, it's very tedious and very difficult to do. So we're going to talk about some of the answers to that. Next slide, please. So part of that is becoming data-driven is a digital transformation that needs to occur. In that digital transformation, it takes two components, and Patrick talked about it and Kristin talked about it. One is technology and the technology that's involved in doing this, and the other one is all the, we'll say, the people pieces of this. So as you're going through this digital transformation, it's critical to have a framework related to a vision and strategy of where you're going with the organization. Rob talked about some of that, and I think he'll talk more in his session. As you look at systems and process architecture, go back to that prior slide of that chaos, that all needs to be organized and created in an efficient way from a system and from a workflow and a data flow. And so the framework there, and I'll share a best practice framework here in a minute, is critical. It needs to be done from a business value and organization and a programmatic operations perspective. We're going to be obviously the short term, you have some of the issues related to performance contracting, but what I'm going to share with you transcends above the performance contracting. That's just one thing that's pressing us right now. You should be structured as a data-driven organization to, you're going to hear me say this a couple of times, to respond to anything that the market throws, or anything that a different payer throws, or anything that occurs within your organization. And then the last piece, which is actually a cornerstone of this, and people miss this all the time, having the technology in place alone is not enough. You have to have an organizational culture and management structure that supports adoption and usage of that. So these are 4 key frameworks that you'll need, and I'm going to dive into these a little bit deeper here. If you go to the next slide, please. One of my favorite graphics just recently came out from the Harvard Business Review, and they laid out the 5 essential components of digital transformation. And it talks about mapping the journey of becoming a data-centric organization. In those 5 components, you have, similar to our organizations as providers, you have people, the consumers that you serve, individuals, and other elements of information. Digitizing that information is absolutely a foundational piece of this. After that is digitized, you now have digital records of ways to look at that, and you have data. And that then transcends or moves into the journey of data analytics and pulling insights of that information. And as you do that, you break down the silos, and so that you have integrated data from disparate systems now into a data, either a warehouse or a lake, that shows and gives you the ability to have meaningful interpretations and insights of that data. But notice across it now is start to talk about process, people, and culture. Once you have that, people will not, it's your standard bell curve. You're going to have your early adopters, your data geeks within your organization that are going to love that. They're going to be all over it. But then you're going to have people that, the majority of people are indifferent, and then other people that are going to dig in their heels. That number 4, a change in behaviors and decisions and strategy based on the insights, taking action with the data, is the hardest part of doing this. So as you're organizing data for this performance contracting, it's not only important to have it, but it's then changing behaviors and actions to improve that. And then it's taking those results, quantifying those results in this fourth or the fifth component, and leveraging, understanding, are we having the impact that we want? And do we need to go back and retool and continue to reflect and analyze and how to improve? So if you take this and go down one step below this, if you go to the next slide, please. These are the 8 steps that we take organizations through and do assessments on to help them become data-driven. In here are 8 steps that detail the prior slide, and there's sub-bullets within each of these. Number 1, establishing a data governance. You have to have a group that oversees this. And Rob talked about this a little bit and will further, but as we look at pay for the performance contracting, it shouldn't be on one individual. It should be a group of individuals that are looking at this and managing it across the organization. You have to define your data strategy. Obviously, in every organization, there's areas where you're good and areas where you're not good. Understanding the strategy to leverage what you have and build what you don't becomes a critical piece. You need to have a data team. That data team is encompassed of people that understand where data sits within your current systems and how it works and how to get to it, and people that know how to use that data once it's there to disseminate across your organization. You're going to want to blueprint your architecture to understand what you have and what you don't have, and fill in the gaps in areas that you don't have appropriate architecture of information systems. And then goes into investing in the data infrastructure. Now that you have if you can get your data organized, what do you put in as a technology to help leverage that data and automate the use of that data? And then 5 rolls right into number 6. It's doing analytics with that data and visualizations and disseminating that out into the organization. And then 7 takes you into, okay, now that we have that out, how does our culture need to change to support becoming data-driven? It will not happen inherently. There are specific things that you must do to do that. And then number 8, is just a reality for our industry today. We have been underserved in the use of technology and understanding of data. The market is now forcing us to understand that data, to be able to use that data to make decisions. You can't go from 0 to 60 in a turn of a button, right? You have to educate people. People will need to understand what this data means and understand how to use that data. That number 8 is absolutely critical. So this is the process that we go through to helping providers become data-driven. If you want to go to the next slide, Craig. So in that, I love this quote. It's out of a book called Atomic Habits by James Clear. You do not rise to the level of your goals, you fall to the level of your systems. So just having the goal of being in the select tier or whatever, the clinically enhanced tier, the goal alone is not going to get you there. You have to have the systems and infrastructure below to support that, not only in the initial state, but continuing. Remember, this isn't going away. This is going to be for years to come. So it's not only this initial out of the gate, it's how do you maintain this over time? So you fall to the levels of your systems. If we go to the next slide, please. So as we go through those assessments, the 5 most common challenges that we have found with providers that are absolutely critical and things you should think about in preparation for the performance contracting. Number 1, I haven't been in a provider yet that had a data governance structure. The data governance structure is a group of individuals, multidisciplinary group, that ensures data integrity, usability, availability, and security of data. It is enterprise-wide, right? And it is not, a lot of people will put the data governance in the arms or the hands of the IT group. And the IT group does not govern the data. The IT group creates ways to use the data. They're the doers of it. This data governance should be at the highest level of the organization. This data governance should be setting policies and procedures, how we use data to make sure that data is accurate and so forth. Number 2, the core systems and providers are not fully digitized. We're in providers that Some service lines have EHRs, some service lines don't have EHRs. We're in some providers where they have an EHR and it's partially implemented. And if you think of when I say core systems, they fall under the EHR, the finance, the human resources, and learning like LMS systems and compliance. You're going to want to make sure that those get digitized. And if they're not today, as we're working to prepare for the performance contract, you're going to want to make sure that you're also building these out to be completely enhanced by having everything in it. The third point is the lack of required expertise to optimize data management. Having a person within the organization that creates an Excel file or even a Power BI report is not enough. As you have everything digitized, you need to organize that information. You need to analyze it, create visualizations, create access across the organization, and then just as important is that last one in automation. So as you're creating that, you want to automate that data flow so that it's not a manual effort and requiring people tons of time. Most organization providers do not have these resources. And so this is where you have to make a decision. Some do, some have partial. This is a make-buy and decision, but it's absolutely critical as you move forward. The fourth piece, if you think back to the slide where I had the chaos, siloed data causes siloed knowledge and insights. And Rob talked about this one as well. Most providers have limited collaboration and cross-functional discussions. As we look at data across, operational people struggle with understanding finance data. HR data is not disseminated across the organization. So when we talk about certifications and turnover ratios, we have no idea what that is, what that means to our area of the organization. And we have no idea what that means, what we can do to improve those metrics. We got to break down those silos, and it has to be a cross-functional effort. The fifth one is organizational culture does not support data-driven actions. I haven't been in many organizations where there's data literacy, where the finance team is educating operations teams on how to create a budget, how to manage to a budget, how to outperform a budget. Few organizations have data accountability where they hold certain parts of the organization for accountability of data integrity and certain parts of the organization for use of data. And also the culture should have recognition and rewards to it. And I haven't been in many of those organizations as well. This last one is critical. It is the people part of this. So aligning the organization and how you use data, how you make decisions with data, and how you'll support that and hold people accountable to that is really critical. So go to the next one, please. So let's look at best practice of what the crazy complexity dots all over the place should look like. So on the left of this slide are all your core systems. Through pulling and the use of today, the advancement of technologies, the technology part is actually one of the easiest parts of this. Creating integrations into source systems to create automation, to pull data, put it into a data warehouse that is, taking disparate systems and combining into one place that gives you insights that you would not have otherwise is absolutely important. And then putting a business intelligence tool, and there's a number of them out there that are good, that sits on top of that helps create visualizations. And a great example of, you see productivity in there, that's pulling data from the payroll system and the EHR system to be able to do that. We'll talk about risk stratification. We're pulling systems information from HRST and the EHR and EIM to do that risk stratification. So once you get it into this data warehouse, it opens the doors to a whole slew of opportunities that you don't have otherwise. If we can go to the next slide, please. Having it there, this is kind of what we believe is best practice approach of using that data, and it is in a balanced scorecard methodology. So it takes each of those key threads of of the EHR, finance, HR, compliance, pulls that data, and then creates reporting within this balanced approach by service line or program within the organization. And when we talk about preparing for, okay, we have performance contracting right now, but that could change or something else could change. Having this structure in place, anywhere from 90 to 95%, gives you the ability to adjust and adapt to anything that comes down the pike, right? So looking at this balanced scorecard and how you're pulling all that information is a good framework for the business value of using data. It's how you should organize the data. It's how you should think about the data within a human services provider. We go to the next slide, please. When you look at the performance areas in the performance contracting, here are the 15 areas that are listed, right? All the ones that are highlighted are covered by the work that's done on that balanced scorecard. So by doing that, you can answer any of the questions, any of the data points that are referenced in this, because you already have that infrastructure built, right? So and that referral discharge piece, that should be highlighted too, Craig. Thanks for putting that. I meant to mention that. That key data within the EHR can easily be reported, analyzed, and understood. And remember, it's not just the first initial report that we're doing to the state. It's year 2, year 3, year 4, year 5, and how we're improving those to improve our status within this preferred provider network that they're creating. So if you go to the next slide, when you look at that, I think there are 83 elements that are requested in this recent release. We did a rough, and there's some subjectivity into this, but we took each of the 83 and grouped them into different categories. So you have supporting complex needs. There's 22 elements, so 27% of it. Operational and administrative processes, 25% of it is there. Workforce is 19%. Quality, there's 15 elements, they're 18%. Risk management is 7% and 9%, and then the continuum services too. So this gives you a focus of that balance, how the balanced scorecard would address some of these, but this is how the state's looking at this performance contracting piece. Next slide, please. So, I try to use this slide as much as I possibly can. It's one of my favorite things. Since I was 25, Peter Drucker, his phrase, if you can't manage what you don't measure, I love it. So it's absolutely critical and a relevant point. If we go to the next slide, please. I just wanted to show you a couple examples. So this is pulling HRST data, and I want to make 2 points here. One, it's giving you a little bit of an example how you're combining data from disparate areas, but it's also reinforcing the need for risk stratification. As we go down performance contracting, understanding most of those individuals with those complex needs, who they are, and the impact that they have on you, and more importantly, the impact that they're having on your performance metrics is absolutely critical. We did this in physical health. It's kind of like the 80-20 rule. Those 20% of the people will drive 80% of the consumption, right? You have to understand who those individuals are and what your plans are for those individuals. That can't be done, in my opinion, effectively in one system. You have to pull in disparate information. In this example, those are individuals on the left, and in the HRST, you have on the reporting, if you're pulling the data, that you can report on the number of people that have risk factors for the fatal 5, as well as GERD, and as well as falls risk. So in this example, that number 1 person up there, 11781, is all 7 risk factors. And on the right, you can see their trending of those of the 22 elements within the HRST over time, and see where they've increased on their scores and where their acuity levels are changing. And then down below, we've integrated in the EIM data to show incidence for that individual. So now we're starting to get a better picture of that individual and understanding more about that individual. If we go to the next slide, you can even go deeper to see a kind of an individual dashboard that talks about the demographics of the individual, the types of adaptive equipment that they use, their chronic conditions, their communication pieces, their risk levels, their diet, their mobility, co-occurring conditions, and incident data. And this incident data is not only EIM data, it's incident data that maybe are non-reportable to the state that providers track. Now we're starting to get a more broader perspective of individuals in that risk stratification. But this is just to show you how you can combine. There's probably 4 different systems that are pulling information into this to be able to give you that view. So it gives you a little bit of that perspective. And then if you want to go to the last slide, Craig. As you think about this, this is not a single initiative. This is truly becoming as a journey of the way that you should be operating. I think what the state is doing has good intent and is needed in our industry. I think it's hard with the volume of it and the speed of it is very challenging. But I think it's also going to influence providers to. You have to kind of jump in with this, and this is a journey. I can tell you that to get to where some of those more mature organizations are, it does not happen overnight. It takes time to go down this journey, but it's one that you have to start because, as we said in the beginning, this isn't going away. This is the way of the future. It's going to get more complex. It's going to get more sophisticated, and it's going to get more focused on outcomes. So, yeah, last slide, Craig. So then if you have any questions, I put my name on here and Bob Hitson. He's a peer of mine. Bob and I have worked together forever. He kind of, so you can, if you have any questions, or we can either address here or you can email us. Feel free.
Thank you, Scott, very much. I think we had a question about automating some data from Excel. Maybe we can ask you to address that in the Q&A. You're welcome to speak to it. Let's bring Rob back in, and I know we would encourage anybody who has more questions, Scott, to reach out to you directly. Thanks for your contact info. And as we kind of bring up your presentation slides, Rob, maybe just anything that kind of segues into what you want to talk about today. And as I let you do that, I just want to say one last thing, Scott, about you look at just what we know, right, from the performance standards. A lot. You look at, hospital discharge and what you're doing in terms of doing follow-up care, credentialing. We've all talked about a lot already today. So how do you really measure those performance areas? Not to mention, we don't really have the pay for performance, and you're going to get paid on performance. So I think data, as we all know, key piece, partnerships, how you accomplish that as an organization. Appreciate all the insights that you shared. But Rob, let me turn it over to you and comment, segue, and feel free to launch into your stuff as soon as you wish here.
Thank you. And I have one slide, so but we have a lot. I want a lot of conversation piece. But what I would say, thank you, Scott. Your data focus is something that we all need to get better at. I think we're all at different levels and scorecards, but I would just an easy equation for me is data plus communication is going to equal success. So data, but we also have to have that communication. And Scott, I think you mentioned that. What I have found in my experience, and this first slide is just my background, and I think I mentioned that. I've been through a lot of different things with being a provider and also helping providers through some pretty challenging times. Implementing behavioral health choices was definitely a big lift for providers, and many of you guys have been through that. So we're on the cusp of this again. So, but I have a couple key points, and then I think we can pretty much get into some questions and maybe some things. But Craig, if you want to go to the next slide, I just have a couple things. Like I said, data definitely plus communication. So I'm going to just focus on communication and and you guys might already be doing this. Some might have iterations of it. Scott, you had mentioned a data governance structure. Some people might have that particular, but they might just have a work group. What I say and what we're trying to do at Hope Enterprises is really having, an internal work group. And whether that includes right now, if it's in its infancy, if it includes that data governance piece, or if you're, depending on where your organization is structured, you're going to need to have something like that and a project plan for that. So just right now, you're going to have, as an organization, we have short-term, we have long-term goals. One of the immediate short-term goals is we're going to get a provider agreement here next month in June, and who's going to review that? So what's your internal flow of things? How's your data right now, and how's your communication between departments working? So here at Hope and others who I talk to, you do need to definitely have an internal work group. You should define what that internal work group is. It should meet on a regular basis, and it should be multi-departmental. Scott mentioned about IT, and a lot of times data does fall on IT. Operations lags behind. Maybe finance has their own type of thing. We really need to, as organizations, whether you're a large organization, mid-size, or small, you really need to get the right people in the room. Smaller organizations might only have, somebody might wear 4 hats, so it might be that one person does 3 or 4 of those things. But you have to identify, what your organization is going to need, but also how you're going to evaluate it as you're moving forward. So here at Hope and other places, you probably have an internal work group. I would look at, as we're evolving and as we're looking through the next couple months, who's going to be providing. We're going to be able to submit data in July, from July through July 31st. So what's our project plan to submit data? Where are we currently at? We talked about, some of us, our Hope included, is, we have some digital and data informatics. Some of it's still done in Excel. Some of it's still done. How are we going to be able to extrapolate that for this first phase? How are we going to get that information out to ODP so that we can be a select provider, or whatever tier we're trying to establish to. So having that project plan is essential, and having the communication throughout your organization is vital. It's not going to, this is a organizational transformational lift that's going to impact every single person in your organization. And we're going to need to, as much as you can, include them on those levels. It's going to be a different conversation as a CEO. It's going to be a different conversation with my compliance department than it is going to be with my clinical team, different from my HR team, different from, my finance team. But we all have to be coming together and talking about how performance-based contracting is going to impact us. And it starts with a structure. So whether you call it a work group, whether you call it a, a catchy phrase for it, whether you have lunches, whether you do it virtually, you need to meet regularly. You need to have actual action items for that. Another action item that you may have, or that should be within this work group, should be, do you have a project plan for credentialing DSPs? If you're looking at, really being in that primary to select group, do you have that plan? Are you working towards that? Some of the things that Scott mentioned, are you working towards a more digitized system? I will guarantee that all of us are not where we need to be. But where are we at in that metrics? Are we a little bit behind? Do we think we're in the middle? Are we a little bit above the curve? With a lot of I've talked a bunch to a lot of people, and we're waiting for more data. We're waiting for things, and I think the time has come where we're just going to have to put what we have. We're going to have to do an assessment of where we're at as organizations, and we're going to have to put our best foot forward. So just for me, one of the things that I struggle with is, we're talking primary to select provider tiers. In the information, it says a few additional measures. So if you're going to be a primary, you're going to be for providers to meet current standards and a few additional measures. Well, we're going to take our best guess at what that means, and we're going to prepare for that. Information is coming. It comes in ebbs and flows. We can all have our opinions on, is it going too fast, or if it's going, at the right speed. But we control the cadence of our organizations. We control that, and we always have. There's always those outside entities. So at this point, you're going to have to take your best guess at what those few additional measures are. We have all 16. We have all the information presented to us. We're just going to have to, come together collectively, internally, and really look at how we're going to kind of make that happen. that's the short term, and there's some long term I mentioned there. But the longer term goals, we have a lot of providers. A lot of the provider network does not have data infrastructure, technology, those types of things. That's very scary. We personally, I feel the same way that all providers do. Is we may not even have the additional resources internally. How are we going to build this? Where are we going to come up with the money? How are we going to? That's really the next. That's that longer term goal. So, are we looking at partnerships? Are we looking at other folks in the community? How are we, and how would we get to a clinically enhanced process? How do we do that? And so, partnerships, collaborations with other providers, I think that's all part of this. But even if you're looking at partnerships, those types of things, you really need to know where you're at and what your internal scorecard is. Whether you have a good way of measuring it or not, you need to take the time and be able to do that. I think a lot of us have, but I think a lot of us still need to be moving ahead with that. So I put a couple of different things in here. It's very high level, but that's really creating a structure within your organizations right now to assess where you're currently at and where you're going, and putting a project plan is, and making sure that infrastructure works for your organization is really key. Patrick and Scott, any?
Thanks, Rob. Yeah, and I think we have some questions. Craig, if you could help out with a few questions that have come in, just directly for Scott or Rob. And as you do that, I think maybe what we want to do is to maybe circle back to the poll a little bit. Some of the things that have been talked about here today in terms of tier levels, and now we have a little bit more information on some of the specifics. We've talked about the volume of measures, but I know we have a couple questions that kind of get to that. But I think, yeah, thanks, Craig, for pulling this up. So I'm looking at this in terms of select, clinically enhanced, just from our poll today. And it looks like we had a big participation in this, Craig. So in any event, 59% of those of you who responded to our poll today selected the select residential or clinically enhanced. 29% answered that they were going to pursue select residential, 32% clinically enhanced. So, and we're a sample size of the state. Kristin, the other day, there was a hearing before the House Human Services Committee. And I think pretty consistently, the messaging from ODP is they expect about half of the providers to be in the primary tier. So I think when you recognize ODP and Kristin today talked a lot about attestations, but at the same time, you also heard, but they have a lot of data. I think they have a good sense of who will qualify based on data from the 2023 standards and data that Kristin mentioned today, what they're going to use. And remember that you have to meet all standards to reach a certain tier. So I think it's great to aspire, but I think also, as you listen to Scott and Rob talk today, and you think in terms of what you really need to do to prepare, I don't think you're going to be alone if you settle in on, we need to prepare right now for those standards that are affecting everyone. We need to focus on the passage of this budget so we get a rate increase across the board for everybody. So let's not lose sight of that. But I think we'll hear Kristin and ODP say, it's okay to be in the primary tier. You have to make that decision for yourself. And I will sort of reiterate that. I think especially early on, Kristin, without hesitation, was able to answer one of the questions I raised again today. Is there going to be any rationing, any allotment? You're only looking for X number of clinically enhanced or select residential providers. Without hesitation, no, please meet the standard. I think that if you sort of see system-wide the difficulty that ODP has placing difficult cases, they want to build capacity there. They hope more people strive to that. But I think what we're hearing as an indication is they don't see everybody ready to elevate to an enhanced tier. I think it's great to aspire to that, but I wouldn't rush to do it. I think if we assess this system change as incremental change, just really, really fast, I think we're kind of doomed to fail. I think you have to do the kind of things that both Scott and Rob are talking about today. Build your system, be strategic, decide what your capabilities are, what it's going to take to meet them. And I think be transformational within your own organizations to align with this proposed change. I think otherwise it's just too daunting to achieve. So that's, I think, part of the messaging that we want to help work with. And I think we'll continue to do a lot of this, but I've talked long enough, Craig. Certainly, Rob, Scott, if you have reactions, but Craig, I want to make sure we get to some of the questions out there before we end the session today.
Just one quick question, just one quick comment to that is, even if you're selected to be primary, your rates are going. So if you already did your budget like us on the fiscal year, you're already set sail for the no rate increase. Your rate now. You're not going to do that. Plus, if your referrals are not limited as of this time frame, then really there's not it's not the best case scenario, but it's certainly not the worst case scenario. So I think to your point, Patrick, I think we have to keep that in perspective. Is there's not a rate decrease with primary, and referrals. I'm hearing back and forth at some point, you wouldn't be able to take a needs group 1, 2, or 3. Those would negatively impact an organization right off the bat. And we're going to have some leeway with that going forward. So just further to calm folks.
Yeah, thanks. And I'll jump back in to say that, when we was first started in a concept paper, you really had no idea or way to do a cost benefit analysis. And now you do. I mean, you at least know that the proposed add-ons for the tiers are 5% for select and 8% for clinically enhanced. But you also now know in some of the performance areas and the standards, there's a cost to do that and to achieve those goals. So I think you have to weigh that out. And I think the automatic advantage that the upper tiers are going to allow you to automatically pass that on to DSP wage. I think there has to be a thoughtful approach. A, you may not be equipped to do that today. And B, do the cost benefit analysis to really see where that puts you. If you pursue a design that is different, doesn't mean that you can't be as or more profitable, but that takes design and that takes strategy and that takes preparation. So, that is what we're trying to do here. So Craig, I'll finally get to you now.
So we do have a couple of questions for Scott about integration of other systems and how, what is your experience on working through that? And then sort of a follow-up to that is how organizations begin to build these data governance teams.
Okay, on the integration piece, today, if you think about those, we'll say those key systems, the EHR, finance, and HR, and the learning management system, specifically, a lot of providers use Relias, right? So on the finance and HR system, we haven't met any system that doesn't have what's called an API. And that's basically a way to integrate into the system and grab the data out of that system. So those are usually pretty straightforward. EHRs can be a little bit more complex. One, some EHRs have what's called a reporting server, which is a mirror image of the production data in a separate database, and you have access into that. It's updated every 5 minutes, so it's in essence almost real-time data. And though that reporting server is easy to access into, but that can cost a little bit of money. Some EHRs do data exports where you tell them what you want and that can be exported out. And some EHRs will not let you in, but they have reports that you can run. I thought I saw a comment on the Excel, in the new tools like Power BI or Tableau, they can integrate data from anything. So if you have an Excel file that you sit in a secure place, that data can be swept right out of that Excel file, if it's in a proper format, right into the data base or the reporting. So typically, those are how the data integrations work. And then again, you're going to want to, there's older technology. The SSIS is a Microsoft package that is built specifically to do data integrations and automate that. But now everybody's going to the cloud pieces where you have the Azure Data Factory. Google has a piece. Amazon has a piece. They're all data warehouse softwares that really automate and make that part of it much easier than it has ever been. And so they have ways to do data integration right through those softwares. The data governance piece is really going to be contingent on the size of your organization. I think the majority of providers will say mid-size to larger, or we recommend a 3-tier data governance structure. We have the leadership team as kind of the oversight of it. And then you have a data governance team that really is made up of key individuals from each of the support areas, as well as your key program lines or service lines. So, we work with providers that have IDA, behavioral health, and children and family services. So each of those service line leaders would sit in that as a data governance, because you're making policies and processes and we'll say rules that transcend across the organization. So having everybody at the table from a multidisciplinary perspective is important, because you're making those decisions. And then there's a third tier, which is really the data, we'll say muscle, where it's IT or someone like our organization that comes in and actually grabs the data, transforms the data, does the analytics, and does the reporting on the data to the kind of direction of that data governance. So that's kind of a three-tiered approach. In a smaller organization, you would probably combine the executive team and the data governance team, might be all in one. So hopefully I have answered the question.
Thanks, Scott. Craig, anything else out there before we go into wrap up and make some final recommendations?
No, I think we can move forward now.
Okay. All right, well, let's do that. So next slide, Craig. I just want to sort of wrap up the day. I think we've given everybody a lot of information, and by far, there's way more information out there that we really encourage you to look at firsthand. So it's all been published. You certainly want to read the implementation plan, pay specific attention to the performance standards, the performance areas. I mean, this is really where I think you get the level of detail where the preparedness toolkit will be of no surprise to you if you haven't had a chance to do that. Largely, that's why we're here, to share information, make sure we highlight things. But I think it is critically important to read the details and step back and really understand the concept. I think as we've talked today, there are big lifts here. And I think just getting a 5 or 8% increase, you have to weigh against implementing a HIPAA compliant EHR, having a clinically enhanced mental health behavioral staff professional ratio of 1 to 10. There are embedded costs in doing this as well. ODP wants to match that with investment in rates and pay for performance. I mean, I think that is part of an overall plan led by the governor's budget. This is transformational change at an even higher level than what we're talking about with performance-based contracting. It is bundled in with a bold investment in this budget. And the governor himself and DHS and the department have been strongly supporting the budget. So we haven't talked about rates today. They're published. There's a comment period that aligns exactly with the comment period on performance-based contracting. So I'll remind everybody, we'll open registration on this today. We have a great collection of panelists next month or next Friday, right around this time. Craig, what time are we doing that? If you can back up to again, so I don't miss a couple of things that I want to say. But I think we're on for 9:30. We're going to really dive into the fee schedule rates. We want to get some balance. So a few more panelists will add to the group we've assembled so far. Tom Krofchek from Melmark has been the chair of our financial management committee. He's going to facilitate that discussion. We're going to have representatives to take a deeper dive. Again, comments important. I will say comments on both fee schedule rates and performance-based contracting. We encourage you to do that. TPA will do its comments early. We will not wait till the end of the period. I think it's important to collect and be strategic and target those. So, submitting comments, developing your strategy. Join us next week where we can take a dive specifically into fee schedule rates. I'm sure that we will learn a lot from our colleagues and some of the approaches and some of the things that we can rally around together. So lastly, I'll just encourage everybody to engage. Partnerships we've talked about a lot today. I think it's important. You don't need to build all of this on your own. In fact, in many cases, that may not be the best course of action. I think if you're going to build infrastructure, you have to look at leveraging experience, professionals, networks that exist in and outside of our industry. We have to do a better job of that. Otherwise, again, if we're going to try to accomplish all of this, the 83 different performance standards on our own, the way we're doing business today, then I think we're doomed. If we're able to transform and align with this system, then there's hope and opportunity, and that's what we want to pursue, and that's what we need to embrace. So this is about really the survival of an industry, and an industry that needs to survive. We need to maintain community services. So, Craig, maybe we can launch the poll. I know we want to ask you If you're interested in having future sessions, we have many other thoughts in terms of all these areas, how we can bring subject matter experts, have discussion. So we'd like to hear from you if you're interested in doing some more of this. Engage with people you trust, reach out. You've got a couple of great resources here from our meeting today. Continue to use all the resources at ODP, as Kristin emphasized, and we would like to continue to bring you more, and we would like TPA to be part of the resources and the solution to work through this together as a community. So engage people you trust. Join TPA if you're not a member. Join our mailing list if you don't want to join TPA. It's free. I love free, and I credit Craig with all the great information that's pushed out on a regular basis so that you don't miss anything. So thank you all for being here today. Craig, you can go to the next slide. We do thank everyone for your participation. I want to thank Kristin for being here earlier. Scott, Rob, thank you as well for all the information you shared. Thank all of you out there today who have joined us. Have a great weekend, everyone. We will be in touch with you soon.